Welcome to the Hope of Thing, a podcast where we discuss TOOF for Tribes Oral Health Program. I am Melissa Atkins, the Training Development Coordinator for the Native Learning Center. Today on the show, we are excited to have Brian Hudson, Founder and Chief Operating Officer of Tooth.com and TOOF for Tribes, and Lisa Hudson, RDH, Founder and Chief Executive Officer of Tooth.com and TOOF for Tribes. Thank you so much for joining us today. It is a pleasure. Would you guys like to go ahead and introduce yourselves and tell us a little about yourselves?
Sure. Yeah,
Sure.
I'm Brian Hudson, and
My name is Lisa. I've been a dental hygienist practicing in probably the same office for about 30 years. And I went to school in Oregon, so I went up there in Klamath Falls, and I'm happy that I've been able to keep a career, and I still am practicing.
your tribal affiliation.
Oh, yeah, and my tribal affiliation is in Oregon, Central Oregon, the small tribal in Coos Bay called the Coos Indian.
In my name, and I'm Brian Hudson. We are obviously married, Lisa and I, and Lisa's been a dental hygienist over 30 years. My forte over the years has been developing products and different brands of consumer products over the years. So TOOF.com and TOOF for Tribes is really a kind of a collaboration for both of us in that we have a product line that's an oral care line. But we started this out with Lisa can explain a little more about what her thoughts are on why she developed this really radically different toothbrush that's been nothing short of a cult following with the people that order it, the people that use it. So she can say a little bit about that.
We make the toothbrush nice and long. We have a lot of 6,000 bristles in it, and it helps cover the mouth better. It foams up better. It massages the gums and removes plaque much better than a stiffer toothbrush. Even the softer toothbrushes out there are still a little bit too hard. So we developed this longer, tapered, bristled toothbrush, easy to hold. It's very comfortable to use, so you use it longer. That's the main goal of brushing.
Yeah, so we got together with a company that I had been doing business with that makes oral care products, that I've been selling some of their products over the years. But Lisa and I got together with them. We talked about this whole idea of a bigger, better brush with more bristles, and it resonated with them, and we developed it with them and eventually launched Toof.com. Toof.com it's a subscription-based company, much like Shave Club and Harry's Razors, where people go on our website and they order their oral care products, and we ship them every month or 2 months, 3 months, 4 months on a schedule that they choose. Because one thing with the toothbrush that many people don't realize is that you really need to change your brush a minimum of every 3 months. I mean, any toothbrush, no matter what you use, is about 85% less effective after 3 months. So even if you're very conscious about taking care of your teeth, you have to have a brush that's doing the job for you. So that's the whole idea of a subscription base for oral care products really resonated with people. And we've expanded the line out now to where we have 3 different sizes of brushes. We have what we call our full-size brush, which is for most adult mouths. And then we have a mid-size brush, which is a little bit shorter, and a very effective one for kids 2 to 6 called My First Tooth. So we can cover everybody from 2-year-olds on up to elders with the brushes that we have. We've added a floss to the line. We're looking right now at a really amazing new floss out of Italy that we're probably going to brand under the Tooth brand. And we're working right now also on our own brand of toothpaste. And we have interdental picks, and we try to provide those everyday tools that really make the difference in people's health, general oral health. So, and that's really how Tooth.com started. And one thing that we looked at after, we've been doing very well at Tooth.com. We said, hey, look, we're a Native American company, woman-owned company. How can we give back? I mean, what can we do? So we decided to develop a program, and it's still in its infancy, but we're calling this one Tooth for Tribes. And, unfortunately, American Indian, Alaska Native, and Native Hawaiian populations suffer from the poorest oral health of any population in the United States. They have staggering rates of untreated tooth decay among children, untreated tooth decay and gum disease among adults. And studies have shown that poor oral health has a direct link to many of the chronic diseases that plague Indian country, from diabetes, heart and kidney disease, Alzheimer's, asthma, osteoporosis, and even cancer, that people don't really realize these problems exist. And the other really bad factor is that Native Americans also face a lot of barriers when it comes to improving their oral health, because they have limited access to dental care facilities, many times no insurance coverage, appointments are not available, and really a lack of basic oral care education. And, really most importantly, a lot of them don't even have a quality toothbrush or the basic everyday dental supplies they need to really effectively fight tooth decay and gum disease. So that's really what motivated us to create our Tooth for Tribes program.
I think it's incredible, and I admire you so much, Lisa. That is incredible. You're a dental hygienist who said, what can I do to help Indian country? And you guys created Tooth for Tribes. And I think that's just so incredible, because you could have said it better. In order to help our community, we have to take care of ourselves. So while you guys are providing Tooth for Tribes, you're giving them the tools, you're giving them everything they need to help better take care of themselves. And affordable help, like you mentioned. Not everybody can get the help, unfortunately. So it's incredible that we have Tooth, because Tooth can provide that.
Right. And yeah, and the way that Tooth works, or Tooth for Tribes works, is we said, look, we already have a business model where we're shipping people oral care supplies every day. We already have customers. We have really faithful subscribers. Why don't we try to take that business model and shift it over a little bit differently? But what our goal is, and is to try to work this with tribes and some of the tribal Indian Health Service regions to provide people the ability to order our products, and we ship directly to their home. Certainly, we have some dental support centers like the USET, which the Seminoles are a part of. Leon Roberts, who's the director of the dental program in Nashville, has really been behind Tooth, sees what we're trying to do, and has really been really our first big advocate out there in in the IHS service areas. And so right now we envision that the great thing about Tooth for Tribes is the other situation with Indian country is everyone is so spread out. Many people don't have the ability to even maybe get to a dental clinic, but they have an address. So all you need to do to be a part of Tooth for Tribes is to have an address that we can ship to. And when something arrives every 3 months with a fresh toothbrush, some fresh toothpaste, floss, it's, wow, look, my tribe cares. And people are more apt to use things that they receive in the mail than if they tried to get something from a clinic, or wait every 6 years or 6 months or a year to see the clinic. So that really we feel the program can be effective, because when we look at this, it's a cost-effective preventative program, and on average it would cost each family member about $5 a month that the tribe would pay for them to get these materials that they need.
Oh, wow.
So
that's incredible.
Yeah.
Was there anything else you would like? I'm sorry, I didn't mean to cut you off. Was there anything else you would like
no,
to
that's
add?
okay. No, we're, so right now, we know also that the key to any successful prevention program, besides the materials and the items you need to stay healthy, it's really knowledge and motivation. So with every shipment that we make, we include educational materials on how to keep your teeth clean, your gums, your mouth healthy, and we try to keep it fun. One
And
thing,
simple.
yeah, and yeah, one thing about TOOF, with the name that we have, and what people like about us is our products are very clinically sound and they're great products, but we try to keep it a little lighter because people don't necessarily want to get hit over the head. And with 9 out of 10 dentists recommend TOOF for people with teeth. We're more like, hey, put a little fun in your mouth. Try TOOF. And we find that that's a much more motivating thing for people.
Right.
It's definitely an attention grabber. It catches your attention, and I like that. I like how you guys are stepping out of the norm, and you're like, well, everybody does that. Dentists recommend this. Well, we recommend you try TOOF, and you should try it because you'll like it.
Right.
I like that approach. Why the design of our tooth? Oh, I'm so sorry. Why is the design of your toothbrush superior and effective? Is that when you guys were discussing the length and the bristles?
Yeah, talk about
Yeah, the toothbrush is designed to hug the curves of your mouth, so much that it feels good, and it's a good massaging feeling. You'll go back and forth a little bit longer in the areas. It's designed to foam the toothpaste depth a little bit more because of the bristles. It holds all the oxygenating toothpaste on there, so it creates more oxygen, and mostly makes people brush longer. If they like what they use, they choose to use this brush and they choose to use it longer, and that gives them better oral health and overall health.
Yeah, one thing I know that's frustrated Lisa over the years is everyone brush 2 minutes twice a day. Well, a lot of people will do the twice a day, but many people don't brush for a full 2 minutes. So when she designed the toothbrush, she said, look, I'm going to make a brush that's not only more comfortable that you want to keep in your mouth longer, but even if you don't, the coverage is going to be so much better that even if you're in there for a shorter amount of time, you'll still get a very effective brush. And one of the things that people always tell us when they first use a tooth, the feedback we hear is sometimes they look at it and go, wow, there's a lot of bristles there. That's an awfully big brush. And we tell them, just try it. Just try it and you'll see what it's all about. And they come back after one use and say, wow, I've never had a brush that leaves my mouth, not just my teeth, but my entire mouth feeling so clean and
Fresh.
and fresh. And I'm going to try to hold this up to the camera. You can see on the top there a little bit how the bristles at the top are a little bit finer than the base bristles. Well,
Yeah.
that's like a flossing action. So those little fine bristles on the top go in between your teeth, and actually it's like a flossing toothbrush. So certainly we want people to floss, but again, if they don't, with this, at least we know that they have a brush that's going to give them at least some flossing effect when they use it.
That is an incredible invention. You made something like an everyday use item even better by adding more bristles and the little built-in like finer bristles to floss your teeth. That's so genius. That's smart. So if you do forget to floss, yeah, incredible, Lisa, like incredible job. That's amazing. So if you forget to floss one day, not ideal, but it's okay because you've got the best brush that's going to help, take care of that. So no buildup. And I saw your face earlier when he said not everybody brushes for 2 minutes. I couldn't help but see your face just like frown. Have you noticed that a difference when people are brushing their teeth now? Have you heard like great feedback about, holding the handle of the brush or anything that stands out to users who have used a brush?
They like the fact that it's soft. There aren't that many soft toothbrushes out there that complete the whole mouth like that. it does look a little big at first, but once you try it, you realize that it covers the whole mouth, and it isn't really as big as it looks. I see only good results, improved results, especially having my patients use it. I can tell that they're using our toothbrush, and especially good for the diabetes patient where they need more circulation at the gum line, especially good for people who have a lot of recession and don't want any more recession that gets caused from the harder toothbrush. We just overall see the improvements. I don't know if I've ever had anybody not like it that used it.
That is incredible. Incredible. Like, congratulations on inventing something so useful and amazing. I personally would like to dive a little deeper into Tooth for Tribes. Um, how are they able to do that? Let's say if a tribe is interested, how would they go through the steps of doing Tooth for Tribes? I know you mentioned that they ships directly to their house, but what's the process look like?
Yeah, that's some of the things that we're trying to kind of work out right now. We've done a couple of regional shows, tribal shows, where we've set up a booth and shown people what TOOF is and what we envision TOOF for Tribes to be. And we actually did get a booth last year at the Res show in Las Vegas. And we really, the whole idea of TOOF for Tribes and getting these materials directly out to tribal members really resonated with the tribal leaders, especially because they do realize that so many of their members, tribal members, don't ever have a chance to get to a dental clinic, let alone maybe every 6 to 12 months, which is the absolute minimum that you'd want to see a dentist. But we also know that one of the things that really resonated with the tribes is that because if people had better oral care, then they will have less of the other more expensive problems that people come into to hospitals and clinics for. Like I said, we're not going to eliminate diabetes, but diabetes is so prevalent across Indian country that we can be a very effective, proper oral care can be a very effective tool to to address a lot of these chronic illnesses that are caused by poor oral health. And dental care is expensive, and most underserved groups aren't covered by insurance, like we said. And what we want to do is take a proactive approach to educate and encourage good daily habits, and offer tribes, tribal clinics, and government agencies the opportunity to prevent more serious and expensive medical procedures down the road. But as far as the nuts and bolts of how TOOF for Tribes works is, we're looking right now in the first quarter of 2023 through USET, which is again, the Seminoles are a part of that. It's a very large, if you look at that service area, geographically, it's incredibly large. It stretches from Louisiana up to Maine. And a lot of these tribes are very isolated, and they either don't have access to clinics, or they can't get appointments for many different reasons. So we're looking at a couple of pilot programs we're going to run through the Nashville office with Leon Roberts, with hopefully 2 or 3 of the tribes in USET, to really see what we can do to put these boxes together and enter the data and the things that we need to put these people on a regular subscription schedule. So at this point, we're kind of working at tribe by tribe in a lot of respects. But our goal would be to, number one, turn TOOF for Tribes into a nonprofit corporation. It's already separate from our toof.com business, but also to possibly talk to IHS and some of the government agency about, look, we have a program here that if we can get some funding for it, we feel we can be very effective in the overall health across Indian country. So that's, like I said, right now, TOOF for Tribes is, we like to say we're trying to improve the health of Indian country one mouth at a time. But if you don't take that approach, how can you get anything done? So that's really where we're at with it right now. And we know that prevention's the most effective way to address all the issues that we discussed.
You couldn't have said it better. That's incredible. I hope you get the funding. I certainly do, because I really do think you can make a great difference in Indian country and really solve a lot of those rooted problems like diabetes, as we mentioned, and all other health diseases. I think is absolutely incredible that it all starts with the toothbrush. And I love the name.
Yeah, and one of the things that we're doing now, because we realize that Tooth for Tribes is going to take a little nurturing and development, is that we're already now to say, hey, look, dental, all the DSCs and the dental clinics and the tribal clinics out there, we're offering 50% off our wholesale price. So we do have a lot of the service centers now that are just buying the brushes from us at a real steep discount and giving them to their patients. So we actually are in the mix at a lot of these places. And what we're looking to do now is to put toothbrush, toothpaste, floss, and do some packs that people that do actually go to the clinics can get this at the end of their visit. So, really it's so cost effective for the tribes because what's cheaper to give somebody a package of oral care products or have them in their diabetes clinic? I mean, it's a big difference in the cost. So, and unfortunately, with the way the medical situation is in the U.S., everything is so expensive that any way we can try to reduce that cost is just helps the tribes. So we're doing even without any funding. That's kind of our end goal. Right now we are selling. We have a lot of native subscribers on our site that get the discount just off our tooth.com that are ordering. And we, like you said, we're also selling wholesale to the dental service centers within the IHS service areas.
Thank you very much for explaining the process. I want everybody to use Tooth. I want everybody to get their hands on it. I certainly want to get my hands on Tooth as well. So I'll certainly be checking out the website. I just want to ask one more question to make sure we really get Tooth out there, or how tribes and tribal members can be involved. I know we just discussed this a little bit. How can they be involved? Is it just by going on tooth.com? Is there a way that they can email you, or
any tribes or tribal leaders that are interested in either getting some wholesale brushes or finding out more about Tooth for Tribes and possibly being one of our tribes to come on board with that? The best, we do have our site at tooth.com, and there are links there that they can get a hold of us directly. We also have right now, it's more of an informational site, but we also have a website at tooffortribes.com. So it's toof, F-O-R, tribes.com. And we're hoping that we'll get a store up there soon, but right now it's more informational for maybe, really for tribal leaders to take a look at. But anybody that's interested can reach out to me at either through info@toof.com or bhudson@toof.com. Those would be the two best places to reach out. Anyone that wants to order off toof.com right now directly for a subscription, we are offering 25% off discount. Here's my advertising here. So the code that they would need to put in when they place their order is SEM23. So SEM23 would be the code to put in. And we're going to leave that active for anyone across Indian country that wants to order off toof.com. But like I said, with Tooth for Tribes, I know there's probably a lot of tribal leaders and people, decision makers that watch your podcasts. They can just reach out to me directly or through info@toof.com. And we'd be happy to all call them directly and talk to them about what we can do with to set up with Tooth for Tribes. And we'll be out there too. We're looking right now. We're probably going to have a booth at the NIHB, National Indian Health Board Conference in Alaska, which is coming up in May. And also we'll be looking to do the Dental Service Center conference, which I believe looks like it's going to be in Nashville this year. So especially any health directors or leaders that are watching the podcast, certainly give us reach out to us and we can give you more information.
Thank you very much. I hope all tribal members and leaders who are watching this reach out to you, both of you, and really just start spreading this amongst, because it really just starts with one person. So thank you so much. Is there anything else that you would like to add for today's episode?
I don't know, Lisa.
Well, we appreciate you getting the word out, through this podcast, and so that we can provide care and better overall health to the community in our world.
And really, we really admire what the I had a chance to meet Georgette in Connecticut and learn a lot about the Native Learning Center. And really like the Native Learning Center, I mean, our mission is to provide Native Americans also with the knowledge, the skills, and the tools to improve the quality of their life, which I know is part of your mission statement. So we dovetail right in there and just add tools as well as the skills and the knowledge. So we really admire what you're doing with the Seminoles and all across Indian country with your podcast.
Yes, whatever we can do to help, we're here. And all our information is also going to be in the link below, as well as Brian and Lisa's. So if you would like to visit their websites, please click below, and any additional sites and links that they have will also be down there. Thank you both so much for today. I truly appreciate it. I hope we could do another podcast once you start going through all the process for Tooth for Tribes. I'm very excited to hear about that and the outcome of that. So if you guys would like to do a podcast in the future of the results and kind of like a temperature check, I'd love to do that with you guys.
No, we'd love to. We'd
yes.
love that also.
Yes.
Once again, for our users, please don't forget to go ahead and click the links below. That brings us to the end of this episode. Thanks to Brian and Lisa Hudson for joining us today. We hope you enjoy the episode. As always, thanks for listening to the Hope and Think of podcast. If you enjoy our show, please rate and review us on Apple Podcasts, Spotify, and Google Podcasts. Also visit our website, www.nativelearningcenter.com, to find information on upcoming webinar and virtual trainings. Be sure to come back for more content. Thank you both so much again for joining us today.
Westa.
Thank you. Okay, bye-bye.